Today, the Senate is debating legislation, or shortly will be debating legislation, that will increase health care costs for working Americans and wipe out a successful bipartisan 45-year-old student loan program without a single committee hearing or even a markup. This bill is an attempt to fix what is perceived to be the problem with health reform legislation that the Senate passed on Christmas Eve of last year. These fixes are being considered because the American people overwhelmingly oppose that legislation. Unfortunately, that bill does nothing to fix the problem the reconciliation bill does nothing to fix the problem that prompted this opposition. Nothing in the bill that we're going to be considering will prevent $500 billion from being cut from the Medicare program to create a brand new entitlement program for the uninsured. If this bill is passed, millions of Medicare beneficiaries will lose the extra benefits they currently receive. In fact, this bill will actually make matters worse, cutting even more money than the provisions in the Senate bill. 1 out of every 4 Medicare beneficiaries are already enrolled in Medicare Advantage plans, and every one of them will see their benefits reduced. If this bill is passed, the care of Medicare beneficiaries across the country will still be put at risk because of the unsustainable payment cuts to hospitals and nursing homes. The President's own chief Medicare actuary said these costs could jeopardize Medicare's beneficiaries' access to care. He said that as a result of these cuts, roughly 20% of all hospitals and nursing homes in the country would become unprofitable, which of course could lead them to end their participation in the Medicare program. It's either end it or go broke. If you can't go to a hospital or get a doctor to treat you, you don't have health care. But this bill does nothing to fix the Medicare payment cuts in the Senate health reform bill from Christmas Eve. This bill will still cause health insurance premiums to increase. The Congressional Budget Office said the Senate bill would increase premiums by 10 to 13% for individuals. They said that 10 to 13% increase is above what would happen if we did absolutely nothing. Yes, escalating health care costs are a problem, but this bill, passed by the House last night, with these supposed fixes that are in here, will increase premiums 10 to 13% for individuals over what would have been done if nothing would have happened. Doesn't sound like a solution to me. There are solutions out there. While most of the discussion today will focus on health care, we must not forget that the reconciliation bill drastically alters decades of education and labor policy. Specifically, I'm speaking about eliminating the 45-year-old family-friendly bank loans for education program, called FFEL. We like to put initials on them when it has anything to do with the government. This one's one that works through the banks, which was successfully helped millions of Americans realize the dream of a college education and the shift to a Washington-run direct loan program. That radical change is happening without a single Senate hearing or a single markup in the Health, Education, Labor, and Pensions Committee, where I serve as the ranking member. This rushed and dramatic shift puts at risk the availability of guaranteed loans for thousands of students this fall. Under the terms of this bill, all 4,000+ institutions of higher education now in the family-friendly bank loan for education program will be required to participate in the bureaucratic direct loan program as of July 1st, 2010. Just a few months away, less than 4 months from today. I do not believe that these schools or the U.S. Department of Education have the time or capacity to successfully meet that deadline. This bill is nothing more than a government takeover that will turn the Department of Education into one of the largest banks in the nation, probably not under the financial reform requirements either, and transfer billions of dollars from middle-class students and taxpayers to pay for only a modest expansion of the Pell Grant program, which does nothing to lower the cost of college education.